Hi everyone, this is Gaurav Gunjan and I am here with my team Ariel, Yuchen and David to present a new product MediSmart that dispense your drugs smartly. Our parent firm is CVS Health and has a purpose of building entire world of healthcare around each and every individual that they serve. And in this presentation, we will be following different stage gates of AVID to present our business model and showcase you why and how MediSmart is a high potential opportunity for CVS Health to integrate their offerings to. Instead of hitting directly to what issues we are trying to resolve, I would invite you to think about the major job steps involved in your prescription medication. You start with finding a doctor, then you make an appointment, you make a visit, get a prescription. Next, you are ordering your drug, receiving it, taking it at your home, refilling it, and at the end, you are trying to understand the effectiveness of the medication. To understand the job better, in what you value in each of these job steps, let's start with the finding the healthcare provider. You want to minimize your time and effort in finding a doctor. Likewise, you value your money and you want your doctor to be covered by your insurance. Similarly, the time and effort minimization applies to your scheduling an appointment as well, as it is always good to get your doctor as soon as possible. Now, when you have an appointment, you want convenience in visiting the doctor. You want to minimize your time while waiting for doctor to see you. Once you have the prescription, you would prefer convenience in knowing the drug is covered or not. Similarly, you want to have generics available because you don't want to pay for branded drug. It is expensive. Similarly, you want your insurance company to cover your drug as well. When it comes to ordering the drug, be it pharmacy or online, you want to save on your copay. You minimize the time and effort to get your order placed. You don't want your pharmacy to tell that the drug is not available. And next, while receiving medication, you don't want to change your pharmacy, so you want a convenience there. Once you have the medicine available in yourself, it is your responsibility to ensure that you're taking medication on time. Would you risk going wrong here? Definitely no, because it has direct impact on your health. Again, you don't want to skip the doses just because you are not able to refill it on time. So you want convenience in refilling as well. Once your drug medication is going on, you want to ensure that it is being effective as well. So you want to make sure that your drug is doing its job. Next, we have specify some success outcomes that you want in your prescription medication, like you want your prescriber to prescribe you a correct drug, your insurance company to cover that drug, your pharmacy to have that drug available with. Similarly, you want to ensure that your loved ones are taking their drug on time as prescribed. Your kid is not able to access to some elderly medication. Similarly, there are some other success outcomes that you want to stay healthy, you want your family to stay healthy, you want to get refill on time. So there are all these different needs that we have analyzed. And finally, after putting those needs in the dimension of importance and satisfaction, we have came up with 7 needs to satisfy, which are currently undersought. And based on these 7 needs, like you want to get correct medication on time as prescribed. You don't want to miss the scheduled prescription dosage and time. You want your family member to do the same. They are also taking time. You want to be aware that when they are not taking drug, and you can reach to them that, okay, you have to take your drug proactively. Again, you don't want your kid to access those. So these are all the undersought needs that we came up with. And based on these identified needs, our target segment consists of all those who are trying to obtain prescribed medication and take the correct doses at prescribed interval.
Okay, let's talk about the demand creation strategy. So there are 3 segments that we are targeting for the smart drug dispensing device. They are elderly person with cognitive issues, parents with young kids, and the busy working professionals. Let's look at how our demand creation strategy works. So taking medication on time with correct dosage is critical to maintain a good health, especially for senior population who has chronic diseases. However, the struggle is that either no solution is used, people DIY relying on self-discipline, or the next best solution on the market is expensive and require manual effort to configure drug dispensers. We are proposing a new solution equipped with smart design that will target the job, get it done better, easier, and faster. Therefore, the switch trigger will be pulled. Then let's take a further look at how our solution differentiates from others. We are proposing a product to store the drug, alert people for medication schedule, and dispense the drug with the correct dosage at the correct time interval. Everything is easily managed via cloud services. In the middle, we have the benchmarking product, which is called Hero. It has majority of the features that can get the target job done. However, we believe we will still disrupt the market with better designs and at a lower cost, since we have a collaboration and a sponsorship with CVS Health and healthcare insurance company. Now let's talk about how we want to enter the market. We will start with innovators, which is a small group of people who will receive the sample for testing. The expectation is that they will share their experiences with their friends in the communities. And early adopters is the population who is responsible for caring the elderly and the children. They will be easily reachable by social media, and they have a high emotional attachment to elderly families. The senior population themselves is highly likely to fall into the laggards, since they have minimal exposure to social media. Then let's look at our solution prototype. Here we have the value proposition canvas. So our value proposition is to obtain the prescribed medication and take the correct dosage at the prescribed interval. We design unique features for a much better user experience during the job execution process. I'll describe the features and explain how those features will generate the benefits in the next few slides. According to the survey and the market research, we have prioritized the following 5 things, which will qualify us to be the best solution and qualify us to be the disruptive innovation. First, our smart drug dispenser will store both pill and the liquid form of drug. We will also design a smartphone app which integrates with the device. We will also have a very powerful customer service network. And within selected CVS pharmacy stores, we offer device training and support. Lastly, we have a unique biometric lock feature to assure superior medication security. There are also several competitive advantages from our company, which are unmatchable by our competitors. First, our solution is a holistic solution for medication adherence. Every patient will have a centralized database. And also, powered by CVS Health, we will provide end-to-end customer service. From cost perspective, we will be able to lower the operational costs since we don't incur additional data collection in the management costs. Lastly, we will leverage the highly integrated resource network so as to drive the economics of scale. This is the app we designed for the drug dispensing device. So multiple users will be able to connect it with the device with authentication. And there is a remote control service available for the user to review the data consumption history. And there will be integrated reminder when a pill is missed. The medication schedule is remotely manageable by the user. There will be a centralized data storage built in the app. Lastly, the medication history can be accessed by the loved one. And also we have 24/7 customer care service available built in the app. And the CVS pharmacy is always stayed informed when the medication is run out of stock, and an automatic on-time refill will be provided. Lastly, let's look at the MediSmart device illustration. So the physical device is cloud connected to the CVS medication app. The user will need to manually load the prescription drug into the device, and the screen displays the next type of medication automatically for the user's ease of use.
Testing the differential value of our proposed solution is the first step in the third stage of the AVID model. Here we have listed attributes and their associated levels for the next best solution, in our case, the Hero medication dispenser versus our proposed solution, the MediSmart device. Okay, here we have 4 different attributes along with price. The first 2, medication type and customer care management, are fairly self-explanatory. However, MediSmart does propose that along with 24/7 technical support, we also get medical consultation. The last 2, medication schedule and safety pledge, deal with how the device will dispense out the medication according to schedule. Currently, Hero does it in the sense where it is manually updated by a user via a mobile device app, whereas the MediSmart proposes the prescription medication schedule be loaded automatically from the cloud to the device. The safety pledge is all about ensuring that the people that are supposed to be accessing the medication are the people who do and not anyone else, such as children or pets. The Hero does use a passcode lock. However, MediSmart does propose utilizing a biometric and passcode lock, so a 2-factor protection. After conducting our conjoint analysis, we were able to determine that the MediSmart is able to provide not only perceived value, but also a value surplus based off of our business model that I will get into in the next few slides. Here we see some different scenarios based off of the market simulator that we were able to access through our conjoint analysis, which also confirms that regardless of price, the MediSmart does have enough utility, and usefulness in order to pull customers in and allow them to obtain a device that not only provides more than enough value, but that also gives them a value surplus in that they are purchasing a device that has the most utility for their value. Here we test our business model, which is the second and last step in the third AVID portion. Here we have our revenue model, which totally, in order to obtain revenue, we have a subscription-based service with a flat enrollment fee of $125 that is incurred upon initiation of the monthly subscription, with a monthly subscription fee of $33.33, which calculates to a $400 per year annual cost. Total revenue for year 1 gets to $171 million, with revenue 5 years from that point at $254 million. Here, we will go into some more detail as to how our revenue calculation was created. We do have, again, our annual unit service fee at $400, with anticipated total device services sold of 465,000 in the first year, and going all the way up to 687,000 in year 5. Our cost model was set up for a subscription-based business. And as you can see, the first year does incur a significant amount of costs when compared to subsequent years. And this is due to the high upfront capital costs that will be associated with getting our device and business up and running. And so here are a couple more details, including our developmental costs, and then some other costs that go into our SG&A, particularly IT being one of the highest cost drivers. Our profit model for the first year gets us to 18.38%. This is not reaching the minimum acceptable profit threshold of 25%. However, we are considering this business model a success given the fact that our actual profit is projected to be at least 76% in the subsequent years.
Thanks. I'd like to start off by talking a little bit about the social and environmental value of our product. The overall goal of our product is to reduce the instances of medication errors and, as a result, lower the overall cost of healthcare. An environmental benefit is that we will be reusing and refurbishing our device when the patients are no longer needing them, so they don't have to be disposed of. Now I'd like to talk a little bit about the marketing channels that we're going to use for our promotion. We'll be using both online and offline marketing channels. For our online channel, we'll create a video highlighting the importance of medication adherence. This video will be posted on all the popular social networking sites. We will also have an email campaign where we'll send this video to current CVS Health customers, and we'll add the video or put the video on the CVS Health website and the CVS Pharmacy app. For offline ads, we'll put up some billboards highlighting the importance of medication adherence and featuring our product. And we'll strategically put these billboards near elderly care centers. And finally, we will invite elderly customers to Health Hub locations where we'll have experts on site to do consultation on medication adherence and also demonstrate the features and highlight the value of our product. Now let's talk a little bit about the conjoint study that we did comparing our product against the next best solution, which is the Hero product, and the current used solution, which is a simple pill sorter. The attributes that we used in our study are the type of medication, customer care management, how the schedule is loaded, the medication schedule, any safety features of the device, the brand, and the price. The next best solution, which is the Hero, can only store pills. It has tech support. The schedule has to be manually entered through a phone app. It has a passcode to lock the medication, and the price is $29.99 per month. Our product can store both pill and liquid medication. It has medication consultation along with tech support. The schedule isn't entered manually, but instead it is loaded automatically from the cloud. It has a biometric lock along with a passcode, and we will charge $33 per month for our product. The current solution, which everybody is using, is the pill sorter, which runs around $11. When we looked at the utility scores in our survey, we found that our product scored the highest for every attribute except the price. We then did a market simulation, a product simulation, comparing our product against the simple pill sorter, and even with the higher price, we still scored higher. And then we compared our product against the Hero, which we scored even higher on. So in summary, I just want to highlight that patients are struggling with medication adherence right now. Our MediSmart product is going to satisfy that undershot need. When we did our simulation and analysis, we found that our product scored higher than the next best solution, Hero, and the current existing solution. Our product is going to be subscription based, so it's going to be recurring revenue that we'll be receiving, and we are tracking to receive after year one around 75% profit on this solution. And we can utilize our existing CVS Health resources, especially our marketing channels. I want to thank everybody for taking the time to listen to our presentation, and we'll be more than happy to answer any questions that you might have.